Many patients also ask about the relevance of PSA screening, prostate-specific antigen. It's a blood test. It's obviously been in the news over the last few years about its value, its relevance. And I think, it is important for men to have PSAs, age 40 years and onwards, especially those who have a family history or those who are African American in heritage. They have a higher chance of getting aggressive cancers of significance. The key to the PSA testing is it really has been around for over 2 decades, and during this time we've seen about a 40% decrease in mortality from prostate cancer. And so early diagnosis has had its benefits in that 40% less people are dying from prostate cancer now than were dying 20 years ago. Recently, the American task force, the task force commissioned by the U.S. government, recommended that maybe PSA screening should not be done in men, and maybe it wasn't important. But I think that's a little bit difficult to understand as a physician, especially since it has had quite a lot of effectiveness and benefit, leading to a 40% reduction in death from prostate cancer. It's difficult to say to a man that you don't have the ability to, know that you have cancer. And I think effectively, by trying to remove the PSA test, men often are having their rights taken away to know that they have these potentially lethal cancers. Now, with that being said, PSA is something that has to be used very carefully. There can be false elevations that can lead to biopsies, and obviously this is not something we want to see. And so I think the key is for a patient to follow their PSA with themselves or with their primaries, and if they start to see a rapid rise or changes that become worrisome, then they should see their urologist and start discussing whether a biopsy is in order or whether they would continue to follow. But I think having a PSA test is important for men, and obviously it can prevent death from prostate cancer.